Epidemiology of the Perthes disease. There is a 1 in 10,000 child is involved, and there is a most commonly male predominance, that is a 5:1, and most common age presentation is 4 to 8 years is the most common age presentation, and there is a low socioeconomic status child is more affected more, and there is a bilateral involvement seen in the 10 to 15% of the cases, but it is a asymmetrical involvement of the, that means asymmetrical involvement, that means different stages of the hip bilaterally. And if there is a symmetrical bilateral involvement, then look for the multiple epiphyseal dysplasias. Clinical features are the symptoms. There is a painless limb is present, insidious in onset. If there is a fall history, there may be acute pain is present, and there may be intermittent pain in the hip, groin, thigh, and knee pain. Physical examination, there is a hip stiffness of the hip and loss of the extension, internal rotation, and abduction of the hip. And gait is the most common gait is the Trendelenburg gait, because head is collapsed, and there is a leads to the decreased tension of the abductors. This leads to the Trendelenburg gait, and there may be, if the any trauma is present or pain is present, it leads to the entalgic gait, and there may be a short limb component of the gait is also present. Limb length discrepancy is the late finding due to the hip adduction contractures can exacerbate the apparent limb length discrepancy. And there is a imaging modalities are the X-ray, pelvis with both hips AP, and frog-like lateral view. In this X-rays, we may see there is a loss of height and increase in medial joint space, and there is a sclerosis and lateral subluxation of the femoral head. In bone scan, can confirm the suspected cases of the leg calve Perthes disease. There may be a decreased uptake, can predict the changes on the decreased uptake on bone scan is seen, provides information on extent of the femoral head involvement. And next investigation is the arthrogram. It is a dynamic arthrogram, can demonstrate coverage and containment of the femoral head, and if there is any femoral acetabular impingement also it can see. It is done intraoperatively. Next, MRI shows early involvement of the growth cartilage. If early involvement of growth cartilage, this leads to the bad prognosis. And there may be a lateral subluxation of the femoral head. Also, there is a horizontalization of the acetabular labrum, and there is a presence of the metaphyseal cyst. It indicates the bad prognosis, and there is an increase in medial cartilage thickness of the femoral head. And next come to the evolution of the Waldenstrom. The first initial stage is the stage of the avascular necrosis. There is a decreased height of the epiphysis, increase in medial joint space, and there is a subchondral fracture that leads to the crescent sign. Next is the fragmentation. Next is the stage of the revascularization and stage of the regeneration. Next is the residual stage. In Catterall in 1971, proposed the classification that is applied during the fragmentation stage. Leg calve Perthes disease, this leads to the 4 groups based on the AP view, lateral view, and arthrogram findings. In group 1, there is only anterior portion of the epiphysis is involved, no collapse and no metaphyseal changes. Course of the disease is absorption of the involved segment followed by regeneration. And group 2 is the anterior part of the epiphysis involved with collapse of the segment. In AP view there is a sequestrum, in center there is a sequestrum. It appears as a dense oval mass with viable fragments on both sides, medially and laterally. Therefore the epiphyseal height is maintained, and lateral sequestration is separated posteriorly from the viable fragment by a characteristic V appearance. And group 3 is the only a small portion of the femoral head, and posterior part is not sequestered, remaining part is sequestered. On AP view, head in early stages. Central sequestrum collapses appears in later stages with small normal segment on the medial and the lateral sides. On lateral, only a small portion of the posterior part is not involved. Metaphyseal changes are present, and there is a broadening and shortening of the femoral neck. In group 4, whole epiphysis is completely sequestered, head is flattened and mushroom shaped, and metaphyseal changes are present, and neck is broadening or shortening is present. Next, Catterall's headed risk signs are they are the these signs are indicates the worst prognosis. First sign is the gaze sign, that is a V-shaped radiolucency in the uh, V-shaped radiolucency in the lateral portion of the epiphysis. There is a V-shaped radiolucency in the lateral portion of the epiphysis and adjacent metaphysis. There is a calcification lateral to the epiphysis and metaphyseal cyst and lateral subluxation of the femoral head and a horizontal proximal femoral physis. In 1971, Catterall proposed this, and 1984, Salter and Thompson proposed applied during the initial stages of the vascular necrosis. If there is a subchondral fracture is involved less than 50%, there is a group A, good prognosis; more than 50%, group B, that is indicates the bad prognosis.